this way. I'm going to measure your right side first so we can see how well that moves, and we'll compare it to your other side. So for hip flexion, do it for stool. Is there a spare stool I can borrow? I'm bored. So for hip flexion, if you have your Bibles out, what is the axis going to be? Greater trochanter. So we have to be able to palpate it and find it. That which is bony, has very little soft tissue over it, and is most lateral, the greater trochanter. It's not here, that's the top of the pelvis, it's here. If you have pockets on these, it's about where your pocket is, the top of your pocket. What is the stationary arm going to be? All right, so she's got a wonderful mid-axillary line right here. So that's kind of easy for us. And then where's the movable? Midline of the femur to the lateral epicondyle.
Talking about printing out yesterday.
Okay.
It has all that information on there.
So we're going to have to make sure we know where that is. A quick reference, find the top of the patella, drop over laterally, find that which sticks out and again does not have a lot of soft tissue over it. Right there above the knee joint, so you're not going below, that's the lateral epicondyle. Now, remember, one of the things I talked about in anatomy and yesterday is you really don't want to establish these and then follow through a range of motion. We can verify the starting and the end position, and hopefully, did you all take math to get into this program? It's simple math. We just subtract the greater from the smaller number. Because if I line this up, which I'm going to do here, and make sure that my goniometer is in the right position, and it should be lying here on the table. I need a little hip flexion contraction. I've got about a positive 1 degree of motion. Yeah. So there you go. All right, relax. All right, so I'm going to say this is 0. So watch if I try to follow this. I'd like you to bend your leg up as high as you can. Where did the axis go? It's on her glute. Okay, that's not going to be very accurate. So what I'm going to have to do is reposition and align these here and relax. Okay, and what I did is a trick. I just pinched the goniometer there so I can let her take her leg down, and then I can read it. Now, did she go beyond 90 degrees? Yes. Okay, so I have 2 numbers to choose from here. I can either choose 65 or 115. Which one do you think I should choose? 115. Okay, with that. So her range of motion, she started out at, and this is one thing, she has a little bit, and we can see it here, just a little bit of relative flexion to the hip. So she started out at 1 degree. So what is her total range of motion? 114. Okay, that's her range of motion. So we verified the starting position, the end position. Her total available range of motion is not 0 through 115, it's 1 to 115, so a total number of 114 degrees of motion with that. So that would be flexion. Now, extension, we would use the same landmarks, but we would have her flip over on her stomach to do that. And so, can you just, well, you'll have to, yeah, flip on, so we're doing the same hip. All right, so we can see the greater trochanter here. So this here, it's a little bit more obvious to see in prone. She has a little bit more of a hip flexion contraction. she's got to work on her hip flexors. Okay, so here if I verify with those landmarks, she's starting off at this way, so I can, wow, 15 degrees. So let's see if we can get any extension. So I'd like you now, one of the things that you have to watch for is you're measuring hip extension. Because she's so tight, she's going to get trunk roll, okay? So we don't want to measure that. So we're going to kind of have to stabilize a little bit here to keep the pelvis down. So can you lift your leg straight up toward the ceiling? Okay, she can actually extend. Okay, and put it down. All right, so she went to 30 degrees. So what is her total active range of motion? 15? Do we add or subtract? She started out in 15 degrees of flexion, but went to 30 degrees of extension. Okay, so she has 45 degrees, although she has a little trouble, we can see here, getting to 0. You have, what's that? Yeah, see? You can see the lines. They're not straight, they have a curve to them. So I would love to do the Thomas test because I'll bet she's got, is that in?
That's why you're going to be the
Yeah.
person. This is exactly
So that was hip flexion and extension, pretty straightforward. All right, so now if you would flip over onto your back again.
Which side, right side?
Yeah, if we want to do a good side. I'll let somebody else do your other side later. So one of the things we're going to do for abduction is we're going to put our axis here on the ipsilateral ASIS, stationary arm across to the opposite ASIS, movable arm down the midline of the femur toward the patella. However, there's going to be a problem here if she abducts. So go ahead and abduct for me. Whoops, she fell off the table. Okay, so that's not a good thing. So I'm going to have her move this way. All right, so that now I'm going to put this table down a little bit so that I can, the wonders of a high-low table. It's great. So with this now, what I can do is palpate the. Usually, what I do, well, a lot of times is once I palpate there, I want to make sure that I line things up and just verify what that position is, and she is at 90 degrees, which would be what on the red scale? 0. Okay, so she is starting off, that's what's called the anatomical reference position that she's starting at. So what I'd like you to do is just take your fingers and hold them there. All right, so now I'm going to ask her to move. So with your, keeping your leg straight, your toes straight, can you scissor out to the side as far as you can? I don't want to measure rotation, okay? So I've got to have her in abduction. So she's got my landmarks there. Okay, great. Move your fingers, and then I can just line this up. Wow, and come back together. So I have 60 degrees of abduction with that. So that's one of my tricks. So I get these here and then have them put their fingers there so that when they move, I can have quick realignment and get that measurement. Now for adduction, what I'm going to have you do is scoot over toward this edge of the table. Now, what's the problem with measuring adduction? The other leg's in the way. So we have to abduct it and get it out of the way. We're going to start with those same landmarks there. I'm just going to re-verify that she's starting at 0. Hold there and there for me. All right, and now with your toes up, come in as far as you can. And I'm going to get that. Now, it looks like a lot, but it's not. Okay, she only has, from that 0 position, she has 7 degrees of adduction. And this is why it's so important to get the ASIS, because the whole pelvis and lumbar spine has tilted. And to make sure that you are not, because if I did this, if I put a midline on her trunk, I would get almost 30 degrees of adduction. She doesn't have that. So this one, it's an optical illusion, but that's why they're so specific that you've got to follow So this trunk started out parallel, but the whole trunk has shifted up. So I'm measuring a deduction at the hip joint, not the whole trunk. All right, awesome. If you would sit up for me. Now we're going to measure rotation. Remember in anatomy, I had had you stand up and sit down. So if she is going out this way, is that internal or external rotation?
Internal.
Internal, good, okay. If she's going in, it would be external. So we're going to measure internal, external rotation. Our axis is going to be the inferior pole of the patella, and we're going to start with this like in this position. So it is perpendicular to the floor. And then our movable will go along the midline of the tibia. Now, does Clarkson have a towel here? Okay, so scoot back just a tad. Okay. And the reason that we're putting a towel there is to try to make this area level with the hip. You don't have really, you have to make sure that your towel doesn't have them super elevated. There we go. So now the hip is parallel with the knee. When she didn't have that there, it was angled down. When I had this folded over too high, it was angled up. So I want to make sure when I look at it from the side, it looks parallel. So we'll have them doing that. So what I'm going to do is just verify that she's starting there, and she's slightly rotated at the beginning. This is probably because you're a runner. Okay, so she's slightly rotated out. So which direction is that? Okay, so she's starting in about 6 degrees of internal rotation. So now what I want you to do is take your foot out to the side. So I'm going to make sure this stays parallel with the floor, and realign these here. And I've got 34 as my end point. So what's her range of motion? 34 minus 6 is 28. So 28 degrees, because she's starting there. So now I'm going to have her do lateral rotation. So I already know this starting position. So come in. Okay, so I'm going to make sure this is parallel with the floor. Go down here and relax. So she went to 30 degrees was her end point. So what's her range of motion? 36, because she started slightly rotated the other way, so 36 degrees. So those are all the motions. This is why you have to verify the start position and the end position so that you can determine the full range of motion. So you've got some time to break up into